Now we look at some blood vessel disorders, not some, a blood vessel disorder that's fibromuscular dysplasia, and we get to look at the link between fibromuscular dysplasia and hypertension. How can fibromuscular dysplasia cause hypertension? That's what we're trying to establish. So this is what a fibromuscular dysplasia is. So at least the smooth muscles in your blood vessel, instead of them being straight and smooth, like their name is, they are kind of like becoming stiff and folded, forming beads. Okay, so these beads could cause narrowing of the blood vessel or total obstruction of the blood vessel. Because this could cause what? Hypertension. When it occurs in places that the blood flow is supposed to be fast, fast, fast. So if the blood flow is not fast, 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 you have a pulling back of blood flow, and this can increase the pressure. So it can cause hypertension because it leads to abnormal narrowing of the arteries generally in the body, and this could actually lead to narrowing of the renal arteries. That's arteries of the kidneys too. Okay. So this will activate the renin, angiotensin aldosterone system, which will now lead to increased levels of angiotensin 2. This will lead to what? Fluid retention in the body. So fibromuscular dysplasia is a non-atherosclerotic, non-inflammatory disease of medium-sized arteries. So common arteries affected is what? Renal artery, the carotid artery, the vertebral artery. But we'll mostly talk about the renal artery when we're talking about hypertension. Okay? Fibromuscular dysplasia. This one is carotid artery one. But it's the same thing occurring at the renal artery too, just like what you have here. So demographics usually affect women that are gone past 50. So on imaging, you see string of beads pattern. Do you understand? String of beads pattern. It's like beads, you know. So how does it cause hypertension? Is the renal artery will be narrowed, and kidney will now misinterpret the low blood reaching the kidney as a general systemic issue. So it will now activate the renin angiotensin aldosterone system, which will now form angiotensin 2. Angiotensin 2, the effect when it gets into the body, it makes it that the blood vessels are narrowed. So one problem leading to another problem. So persistent elevation of blood pressure is there. Okay, renovascular hypertension. Clinical features is you have hypertension that is resistant to medication. You are treating, but it's not going away. And this hypertension could even occur at young age. Even people under the age of 35 could be affected. Abdominal bruit, there's a whooshing sound over the renal arteries. That's when it's tried to listen via a stethoscope. And the blood pressure is worsening, and there's associated blood vessel issue like stroke, aneurysms, arterial dissections. So you diagnose this blood vessel issue by doing all those CT angiography, MR angiography, duplex ultrasound, where for all the imagings you see a characteristic string of beads appearance. Okay. So management include all those angiotensin converting enzyme inhibitors, angiotensin receptor blockers, calcium channel blockers, diuretics. Also the percutaneous transluminal angioplasty. The lifestyle measures like you reduce the area of smoking, reduce salt intake, and regular monitoring.